Hello dear friends, how are you today? I hope you are well. Here we are going to talk about another question of cardiology. A 28-year-old man presents with a 2 hour history of rapid palpitations. He feels light-headed but is otherwise well. On examination he has a pulse of 170 beats per minute, regular. His pulse is regular. His blood pressure is 100 on 68 mm Hg. He had 2 similar episodes of feeling palpitations in the past 3 months. What is the single most likely rhythm disturbance? A. Supraventricular tachycardia. B. Ventricular fibrillation. C. Ventricular tachycardia. D. Ectopic beats. E. Atrial fibrillation. As we can see here, we have a 28-year-old man, a young man with 2 history of rapid palpitations. It means that the patient has supraventricular tachycardia. He feels lightheaded but is otherwise well. His blood pressure is 100 on 68 mm Hg, and this episodes of feeling palpitations is repeated in the past 3 months. The best choice here is supraventricular tachycardia. Here we are going to explain a little more about it. The given history of palpitations, lightheadedness with tachycardia, plus a history that this has occurred before gives their likely diagnosis of supraventricular tachycardia. Okay. Supraventricular tachycardia or SVT is a rapid heart rhythm that originates above the ventricles, typically involving the atria or the atrioventricular node. It often presents with sudden onset of palpitations, dizziness or shortness of breath, and is usually seen on ECG as a narrow curious complex tachycardia with a rate usually between 150 to 250 beats per minute. As we can see in this ECG, it's showing lead 2. We can see a supraventricular tachycardia, a regular rhythm with increased rate here. This is supraventricular tachycardia. Oh, okay. Although supraventricular tachycardia is usually not life-threatening, it can cause significant symptoms and hemodynamic instability in some patients. As we can see here, the patient's blood pressure is a little decreased. Is 100 blood pressure on 68 is a little low for a young man with 28-year-old age is a little low. Okay. Diagnosis is primarily ECG based, and management includes carotid sinus massage or the Valsalva maneuver, medications like adenosine or beta blockers, and in recurrent cases catheter ablation. Okay, we must see the patient sign in symptoms and the general condition of the patients. The first choice is Valsalva maneuver, carotid sinus massage. But if the rate is not controlled, we can use adenosine, or we can use the combination of Valsalva maneuver or carotid sinus massage with adenosine or beta blockers. But in recurrent cases, we must think about the anatomical abnormalities in the heart, and catheter ablation is useful. Early recognition and appropriate treatment are key to preventing complications and improving quality of life. Here was a short explanation about the young patients coming with the complaint of rapid palpitations, which was repeated in the past 3 months with the diagnosis of supraventricular tachycardia. We talked about different types of tachycardia: ventricular tachycardia, supraventricular tachycardia, atrial flutter, and atrial fibrillation in our other YouTube videos. For more information, you can watch them. Thank you for your attention.